This is the news in brief from the United Nations. Ukraine addressed the UN's highest court on Monday, where it rejected Russia's claims that genocide has been committed in eastern oblasts as a grotesque lie. The International Court of Justice, ICJ, also heard urgent appeals from Kyiv's representatives to halt Russia's offensive, with claims that Russia had reduced the 1948 Genocide Convention to confetti. The development came on day 12 of the crisis in Ukraine, where cities have been surrounded by Russian forces and more than 1.5 million refugees have fled the country. In opening remarks to the World Court, Anton Kornievich, permanent representative of the President of Ukraine, insisted that the court had a responsibility to intervene.
Let us settle our dispute like civilized nations. Lay down your arms and put forward your evidence. Ukraine respects this court and follows its orders. Russia must as well.
Russia, which was absent from the proceedings, was due to respond to Ukraine's request on Tuesday. UN Rights Chief Michelle Bachelet on Monday rounded on what she called the sharp reversal of achievements in Sudan after last October's military coup. Speaking at the Human Rights Council in Geneva, the UN High Commissioner for Human Rights said that the military takeover had again plunged the country into profound crisis and eroded 2 years of reform after the overthrow of longtime dictator Omar al-Bashir. Thousands of people have continued to take to the streets in peaceful protests, but they're being met with live ammunition, in clear breach of international law, Ms Bachelet said. She noted that by late last week, credible medical sources reported that 85 people had been killed so far following disproportionate use of force by security forces during protests, including 1 woman and 11 children. Almost 300 million jobs could be created by plugging gaps in care services, the UN Labour Agency, ILO, said on Monday. According to the International Labour Organization, hundreds of millions of people who look after their families do not have adequate social protection. This included nearly 650 million women whose maternity cover does not provide 14 weeks minimum time off work, on at least 2/3 of their previous earnings. Paid maternity leave or protection is a universal human and labour right, the ILO report insisted, but it found that 82 of the 185 countries that it surveyed did not meet these standards, and that at the current pace of reform, it will take at least 46 years to achieve minimum maternity leave rights in all countries. For men, more than 1.2 billion live in countries with no entitlement to paternity leave. And where there is paternity leave, it remains short, the ILO said, pointing to a global average of 9 days only. Transforming care policies and making them available to all would cost $5.4 trillion globally, the UN agency calculated, although some of this could be offset by an increase in tax revenue from the additional earnings and employment. Daniel Johnson, UN News. This is the news in brief from the United Nations. On day 13 since the Russian invasion of Ukraine, UN Rights Chief Michelle Bachelet repeated her call to all parties to end the war, which humanitarians on Tuesday described as apocalyptic. At the Human Rights Council in Geneva, Ms Bachelet said that since Russia invaded Ukraine on the 24th of February, at least 1,335 civilians have been confirmed wounded or killed. The true number is likely to be much higher, the High Commissioner's office said, noting that most civilian casualties were from airstrikes and explosive weapons used by Russian forces with wide area effects, including heavy artillery and multiple launch rocket systems. From the Red Cross, spokesperson Ewan Watson repeated the call to establish safe passage for aid workers.
This situation is really apocalyptic for people. It is getting worse. They are running out of essential supplies. So when you ask if this is a matter of life or death, or is it life-saving, yes, for us, it is essential that humanitarian aid gets into a city like Mariupol and to other cities that are in the midst of conflict in Ukraine today.
The situation also remains dire for all those in need of healthcare in areas subjected to shelling. According to the UN Health Agency, 16 attacks on health facilities have now been verified, claiming 9 lives and injuring 16. In Ethiopia's Tigray, conflict has deteriorated significantly, UN Rights Chief Michelle Bachelet has warned, as fighting has extended to other parts of the country. In an update to the Human Rights Council covering the last 4 months in Tigray, Ms Bachelet said that multiple airstrikes had apparently been carried out by the Ethiopian Air Force there. Further strikes have happened in neighbouring Afar, resulting in deaths of civilians and casualties and the destruction of property, the UN rights chief said, noting that her office has recorded more than 300 killings from aerial bombardments during the most recent reporting period, covering the last 4 months. The Office of the High Commissioner also received reports of more than 300 rapes by Tigrayan forces in the Amhara region between the 1st of November and the 5th of December 2021, Ms Bachelet said, adding that most survivors have not received any form of support. International Women's Day is celebrated on the 8th of March, and to mark the date, UN Chief Antonio Guterres has insisted that the world must not emerge from COVID-19 with the clock spinning backwards on gender equality. The Secretary-General, who has long championed the role of women in senior management positions within the United Nations, highlighted the contribution that women have made to ending the COVID-19 pandemic. He also hailed the ideas, innovations and women activists who are changing our world for the better, but pointed out that women and girls have often been hit by the worst consequences of the coronavirus, from being shut out of schools and workplaces to being victims of rising poverty and domestic violence, and also having to do the vast majority of the world's unpaid but essential care work. To remedy the situation, Mr Guterres urged ongoing efforts to guarantee quality education for every girl, massive investments in women's training and decent work, effective action to end gender-based violence, and universal health care. Daniel Johnson, UN News. This is the news in brief from the United Nations. The exodus of millions of Ukrainians from their country following the Russian invasion could overwhelm neighbouring countries, UN humanitarians warned on Wednesday. To date, more than 2 million people have fled Ukraine, most have found shelter in Poland, and more than 200,000 have reached Hungary. Slovakia has taken in more than 150,000 from its embattled neighbour since the 24th of February, when Russian forces began shelling and bombarding Ukrainian cities. Latest estimates from UN aid agencies suggest that 4 million refugees are likely by the end of the war, which represents about 10% of Ukraine's population. The development follows news alerts that a Russian strike at a hospital in Mariupol has left children buried under the rubble. According to the World Health Organization, WHO, there have been 18 confirmed attacks on Ukraine health facilities. Top UN-appointed rights investigators on Wednesday urged renewed efforts for a political solution to Syria's devastating war amid an uptick of violence and a deepening humanitarian crisis. The latest UN Human Rights Council mandated report on the conflict points to hundreds of thousands of civilians killed after more than 10 years of conflict, more than half of the pre-war population now displaced, and 14.6 million people dependent on humanitarian aid. In Syria's northwest, many people forced from their homes are still living in flimsy tents, stuck in snow, rain and mud, the investigators said, while in the northeast, tens of thousands of women and stateless children linked to ISIL fighters are still being held in the notorious Al-Hol camp complex. Here's Commissioner Lynn Welchman.
The conditions in Al-Hol are absolutely appalling, and the number of children and other numbers of mostly women who are detained come interned there. It's a dreadful situation, humanitarian-wise and security-wise. And it's one of the things that we are most concerned about in terms of what's happening in Syria. They want that, in some cases, could at least be addressed by third nations who are able to take back their nationals with their children.
The commissioners said that the camp has seen more than 90 murders and 40 attempted murders in the past year. To Nigeria, where the UN is giving a boost to life-saving mother and childcare to conflict-affected communities in the country's northeast. For 13 years, women and children have paid the highest cost of the conflict in northeast Nigeria, the UN Children's Fund UNICEF said on Wednesday, adding that 170 youngsters died in 2020 as a result of the insecurity. UNICEF announced the initiative after delivering essential medicines worth more than $430,000 to Yobe and Borno states. An additional $500,000 has also been pledged to help implement the rollout of primary healthcare in both states. The development means that pregnant women in Yobe and Borno will be able to access healthcare in their communities and receive essential drugs, tests and basic medical support close to their homes. New guidelines on abortion are now available from the UN Health Agency in a bid to prevent more than 25 million unsafe terminations that happen each year. Nearly every death and injury that results from unsafe abortion is entirely preventable, the World Health Organization (WHO) insisted. To keep women and girls safe, it's released over 50 recommendations spanning clinical practice, health service delivery, and legal and policy interventions to support quality abortion care. The medical procedure is simple and extremely safe when it's carried out using a method recommended by WHO, the agency said, but worldwide only around half of all abortions take place safely, causing around 39,000 deaths every year and resulting in millions more women hospitalised with complications. The recommendations are easy to find. Just search online for who.int. Daniel Johnson, UN News. This is the news in brief from the United Nations. 2 weeks into the Ukraine crisis caused by the Russian invasion, the UN Health Agency issued a warning on Thursday that all those who fled the country must receive basic vaccine protection. Since the conflict began on the 24th of February, 2.3 million people have fled across Ukraine's borders. Vaccination against diseases such as COVID-19, measles and polio is especially important for the most vulnerable population groups who are at risk of severe outcomes, said the World Health Organization's Dr. Siddhartha Datta. As far as COVID-19 is concerned, this means older adults and people with underlying health conditions, and for routine vaccines, young children need to be up to date with all scheduled vaccine doses, he explained. Many countries in the European region that are hosting refugees from Ukraine already offer vaccination services to children and adults. Hungary, Poland, the Republic of Moldova and Romania in particular have seen large numbers of refugees crossing the border from Ukraine. WHO is already working with these and other countries to strengthen disease surveillance and ensure provision of immunisation services in line with the policies of host countries. Staying with COVID-19, the global failure to deliver enough vaccines to developing countries is prolonging the pandemic and causing tens of thousands of preventable deaths every week, the Human Rights Council heard on Thursday. To date, more than 10.5 billion vaccine doses have been administered globally, said UN High Commissioner for Human Rights Michelle Bachelet, but the grim reality was that only around 13% of people in low-income countries have been vaccinated, compared with almost 70% in wealthier nations. Head of the UN Health Agency Tedros Adhanom Ghebreyesus also insisted that inaction on vaccine inequity was responsible for the deaths of more than 60,000 people a week, as countries with high vaccination rates are reopening, while others with low vaccination rates and low testing rates have been left behind. To Ukraine, where there's been swift condemnation following Wednesday's bombardment of a maternity hospital in Mariupol, which reportedly claimed many lives, including children. Speaking out against the attack, which comes 2 weeks since the start of the Russian invasion, WHO's Tedros Adhanom Ghebreyesus expressed solidarity with health workers still trying to save lives there.
In Ukraine, the health system is struggling with COVID-19 and dangerously low oxygen and medical supplies, while war rages around them. I reiterate, the attacks on hospitals, medical personnel, and medical transports are forbidden under international humanitarian law. Any such attacks are grave breaches of the Geneva Conventions.
At least 2/3 of households with children have lost income since the COVID-19 pandemic hit 2 years ago. That's one of the findings of a new report from the UN Children's Agency, UNICEF and World Bank. It presents findings from 35 countries and notes that households with 3 or more children were most likely to have struggled to make ends meet, with more than 3/4 seeing a reduction in earnings. Families cannot afford food or essential healthcare services. They cannot afford housing, said the report, which described how the poorest households are being pushed even deeper into poverty. The number of children living in poverty and without access to education, health, housing, nutrition, sanitation or water soared to approximately 1.2 billion in 2020. An estimated additional 100 million children were projected to have fallen into multidimensional poverty in 2021, UNICEF said, in a call for the rapid expansion of social welfare assistance, including cash transfers and child benefits for all. Daniel Johnson, UN News. This is the news in brief from the United Nations. The UN Rights Office reiterated deep concern on Friday at the increasing number of civilian casualties in Ukraine caused by Russia's ongoing invasion. The development came after reports that a psychiatric facility near Kharkiv had been bombed, one of 29 health attacks in the last 15 days, as the Russian military has advanced deeper into Ukrainian territory. Any targeting of non-combatants could amount to a war crime, the Office of the High Commissioner for Human Rights said. 15 days into the war, schools, hospitals and nurseries have been hit by shelling, said spokesperson Liz Throssell. She explained that the maternity hospital in Mariupol that was attacked on Wednesday was both clearly identifiable and operational when it was hit.
We remind the Russian authorities that directing attacks against civilians and civilian objects, as well as so-called bombardment in towns and villages, and other forms of indiscriminate attacks are prohibited under international law and may amount to war crimes.
Latest UN data indicates that 549 civilians have been confirmed killed and 957 injured in Ukraine. But the fact that mass graves have had to be dug to bury the dead indicates that the true figure is likely to be far higher. To Afghanistan, where the country's women must be given the space to lead if it's to find peace and progress, the UN's High Commissioner for Human Rights, Michelle Bachelet, said on Friday. Speaking after visiting Kabul on Thursday, Ms. Bachelet said that the Taliban's takeover last August had led to a drop in the number of people dying in conflict, although reports indicate that door-to-door searches were continuing for former government officials and members of the Afghan security forces. Among ordinary Afghans, there were still heartbreaking reports of mothers being forced to sell a child to feed the rest of the family, the High Commissioner said, as she warned that the humanitarian and economic crisis in the country today may claim far more lives than violence. In an appeal to the Taliban, Ms. Bachelet urged authorities to allow maximum space for freedom of expression and peaceful assembly, to respect the role of independent media, and to refrain from using any violence against anyone expressing criticism.
The women of this country are often portrayed in the international forum as victims. In fact, Afghan women have, in the face of war, extreme poverty and unspeakable violence and discrimination. They have been working tirelessly to protect and provide for their families and communities. They are not passive bystanders.
In Somalia, assistance has been scaled up to thousands of people displaced by severe drought, the UN Refugee Agency, UNHCR, said on Friday. The move comes after 3 consecutive failed rainy seasons that have decimated crops and livestock. In the first week of March, more than 17,000 people in Southern Bay region were displaced by the drought, joining tens of thousands more who were also forced to leave their homes since the start of the year. If the current trend holds, UNHCR estimates that 500,000 Somalis will likely be displaced before the end of March. So far, shelter materials, hygiene items and other necessities have been delivered to 36,000 drought-affected people in the country. This includes 24,000 in Galmudug and Puntland regions, where the situation is most dire. Separated and unaccompanied children are being provided with medical assistance, psychosocial support and counselling, as well as safe spaces to protect them against forced child recruitment. For this year, the UN agency needs $157.5 million to deliver critical aid and protection to 2.9 million internally displaced people in Somalia, as well as around 15,000 new arrivals from Ethiopia and other countries, among others. As of the 1st of March, only 5% of that amount has been received. Daniel Johnson, UN News.